Hi, this is Michael Wahl, owner of Cedar Grove Senior Health Solutions, an insurance agency in Covington, Louisiana, which we specialize in Medicare. If you're turning 65, we get it. Medicare is extremely confusing. We have a team of professionals that have helped thousands upon thousands of individuals navigate Medicare very safely. So over the years, we developed a very short 30-minute instructional video that provides you a step-by-step process of what you need to do for your Medicare. And we give you the opportunity to go ahead and join this today. Okay, let's go ahead and kick off this webinar. And what better way to kick it off than to show off my beautiful family? This is my amazing, gorgeous wife, Anna, and then my great children, Emma, Ethan, Hayes, and Elijah. I am the owner of Cedar Grove Senior Health Solutions. We've been in business for a little over a decade now. We're licensed in over 40 states, and we have helped thousands upon thousands of individuals transition safely into Medicare. Okay, so a little bit more about our agency, Cedar Grove. This is our team here. They're a great, wonderful team. We're very educational focused. So we understand, look, Medicare is extremely confusing. We want to simplify that process for you and make it very digestible and easy to understand. We have over 340 five-star Google reviews. We're extremely excited about this. And this is because this is a true testament to the customer service that we provide to our clients. We offer in-person learning as well as digital learning, which is the current format that we're conducting this in today. So our office is located here in Covington, Louisiana. If you're ever in the area, please stop in, pay us a visit. We'd love to see you. Sit down, have a cup of coffee, and get to know you a little bit more. If not, please go ahead and connect with us on social media. You can find us on Facebook or you can find us on Instagram. Now, you're going to hear a lot about Johnny and Janet throughout our discussion today. This is my mother and father-in-law. They're my clients, and they have a unique story to them. So each one of them have separate plans. Now, Medicare is not a one-size-fits-all. Your option needs to be tailored to you specifically, so that way you can make sure that your coverage fits your individual needs. Now, we're going to start at the very beginning, and where it all started is original Medicare. Now, I like to think of a house. So with any house, you need a very strong foundation to that house. Now, the foundation of Medicare is known as original Medicare. Now, there are two parts to that foundation. One part is hospital Part A coverage, so that's any services administered in the hospital, and that comes with a premium of $0 for most individuals unless you haven't worked for 10 years of your life. Now, if that is you, please, we'll discuss that on your one-on-one consultation to find out what your Part A premium would be. The second part, Part B, this is your doctor coverage. So essentially everything outside of the hospital. So this is your doctor visit, such as your primary care visit or your specialist visit. It comes with a premium of $185 for most individuals. Unless you're a higher income earner, you will be charged more. Or if you're a lower income earner, it could be as low as $0. So this is definitely, we're going to let you know what your Part B premium is when you book that one-on-one call with us. All right, so now let's talk about the actual enrollment scenarios of Medicare, right? So what I'm going to do is detail this down individually, but before we go ahead and do that, what I want you to do is go ahead and analyze which bucket you fall in here. Let's start with scenario one. So this is assuming that you're currently receiving Social Security benefits. This is by far the easiest out of all of them. Now, what you're going to do here is you're automatically going to be enrolled into Original Medicare. You're going to receive your red, white, and blue Medicare card 3 months before your birthday month. It's going to show up in the mail. And then the last thing, the $185 that we talked about previously, which is your Part B premium, that's automatically going to come out of your Social Security check. Now, you're pretty much home here. The only thing that you need to do is secure your secondary coverage. Now, this is something that we're going to go ahead and discuss a little bit later in this webinar here. Scenario two. So this one's going to require a little bit more work from you. So this is assuming that you're not currently receiving Social Security benefits. You have to take a manual step. You got to enroll in Medicare. There's 4 ways to manually enroll in Medicare if you fall into scenario 2. The first way is online, over the phone, in person, or by mailing an application into Social Security. Now look, we've helped thousands, like I said, transition to Medicare safely. By far, the easiest way to do this, in our experience, is the online application. But it gets even easier. We created a very short instructional video, step-by-step process of exactly how to enroll into Medicare online here. Scenario 3, so this one's a little bit tricky. This is assuming that you're currently still working and you're covered by your group health insurance plan. Now, the beautiful thing is when you turn 65, you have the option of enrolling into Medicare, or you can stay on your group health insurance plan. Now, what we're going to do is we're going to stack both of these options side by side, your employer plan as well as your Medicare, and we're going to see which one is the best fit for you. Now, a lot of the times I hear from individuals and they say, hey, Michael, I'm working right now. I'm going to stay on my group health insurance plan. And we pump the brakes and we say, wait. Now, the reason for this is we want to make sure that you're making a sound decision. A lot of the times we find out that Medicare is superior coverage to your group health insurance plan, where it might actually be a lower cost and you may not have a network whatsoever if you join Medicare. So you can see any doctor that you're choosing. Now, if you ultimately choose to delay your Medicare and stay on your group health insurance plan after we have our consultation, we will help you delay your Part B of Medicare, so that way you won't be charged for Medicare and your group health insurance plan. And we'll go ahead and provide this form to you a little bit later on our one-on-one call. Okay, so let's talk about Medicare enrollment. When does my Medicare start? Your Medicare is going to start the first of your birthday month. Unless you were born on the 1st, your Medicare will start the month prior. So let me put this in simpler terms because this one trips a lot of people up. If you were born on October 15th, your Medicare will start on October 1st. If you were born on October 1st, your Medicare would start on July 1st. Now, Medicare is an amazing foundation, but it does have some holes with it. And let's go ahead and address those major exposures that you have with the foundation of Original Medicare. On the Part A side, remember, which is your hospital coverage, you're going to have a deductible roughly of about $1,700 per hospital stay. Now, I want you to note this is per hospital stay. Now, if we walk over here to the Part B side, remember this is your doctor coverage, you're going to have a deductible of $257. Not a big deal, right? But wait for this one. You're going to have co-insurance. You pay 20% with no limit. Now, what does that mean? Every single bill that you receive, you're going to be responsible for 20% of that bill with no limit whatsoever. This one exposure alone could derail your whole financial retirement. Part B excess charges, you pay 15% here. We're going to dig a little bit deeper into this one in a few slides into the future. Now, the obvious question here is, well, Medicare, Original Medicare, the foundation, has some exposures, Parts A and Part B. How do I cover those exposures? Well, there's traditionally two routes that you can take to cover both of these exposures. The first one is with a Medicare supplement. The next one is with a Medicare Advantage. You're turning 65 years old. I would only assume that you're being inundated by a tremendous amount of mail, bombarded by phone calls, and all of this noise that you hear is regarding Medicare supplements and Medicare Advantage plans. My role with this webinar here is to make sure that I cut through all of that noise, give you clear, concise information, so that way, by the end of this video here, you can make a sound decision what route might possibly be best for you. All right, so let's go ahead. This is going to be the part where you actually take out your Medicare cheat sheet or a piece of paper, and I want you to go ahead and draw a line right down the center of the page here. On the left-hand side, what I want you to do is write Route 1, Original Medicare, and on the right-hand side, what I want you to do is write Route 2, Medicare Advantage. So starting with Route 1, Original Medicare, you're going to have Parts A and Part B, which is Original Medicare. Then you're going to couple that with a Medicare supplement and also possibly add on a Part D prescription drug plan. So this is Route 1. If we move over to Route 2, which is Medicare Advantage, you're going to have Part A, Part B, and Part D all wrapped up into something called Part C, also known as Medicare Advantage. So let's dig a little bit deeper with both of these options side by side, right? So we have option 1 and option 2. Now these are the two options to cover the major exposures of Original Medicare. First one is a Medicare supplement. The price on this, you're going to have a Part B premium regardless if you go with a Medicare supplement or if you go with a Medicare Advantage plan. You're not going to avoid this Part B premium whatsoever. The next thing is coverage. You're going to have the lowest out-of-pocket expense with a Medicare supplement. It's going to offer you the most robust, comprehensive coverage that Medicare has to offer with option 1 with a Medicare supplement plan. You're not going to have a network, and this is a beautiful thing. You can see any doctor of your choosing as long as that doctor accepts original Medicare. Majority of doctors in the US do. So let's go back to Janet and Johnny, right? So Janet and Johnny, they have a Medicare supplement. They live in Louisiana. They frequently travel to Colorado. Their health insurance is going to act exactly the same in Colorado as what it acts over here in Louisiana. And that's a very nice feature here. The last one is Part D coverage, right? So you need to pick a standalone prescription drug plan to cover your prescription drugs here. This one's going to be tailored to your individual situation. We're going to touch base on this a little bit further in the webinar. Now let's move over to Route 2, Medicare Advantage. Remember the price? Part D, you still got to pay that $185 premium. Unless you're a higher income earner at that point or a lower income earner, then this may be higher or lower depending on your income. Coverage with the Medicare Advantage, I like to equate this to an employer plan. So think about an employer plan. You're going to have maximum out of pockets. You're going to have copays. You're going to have deductibles with that plan. Well, a Medicare Advantage is going to act exactly the same as that. And you're also going to have a network here, just like your employer plan. You have to see certain doctors that actually accept and are contracted with that specific plan. Now, the nice thing about a Medicare Advantage plan is that Part D and these extra benefits are typically built and wrapped into this plan. So you don't have to purchase it separately like what you would have to with a Medicare supplement plan here. And one thing to note on these extra benefits, a lot of individuals love these because it offers dental, vision, gym, and over-the-counter type benefits, which is a very nice feature here. Now, what I want to do is stack up both of these options side by side for you, right? Now, if I only had 60 seconds and I was in an elevator and I had to give you my explanation, what is the difference between option 1, Medicare supplement, and Medicare Advantage, option 2, this would be it here. Option 1, Medicare supplement. You're going to pay a little bit more for this, but you're going to get better coverage, the best coverage that Medicare can buy. You're not going to have a network. You're free to see any doctor of your choosing as long as that doctor accepts original Medicare. Medicare Advantage plan. Your coverage, you're going to have higher out-of-pocket expenses with this. It's going to act like your employer plan. Your price on a Medicare Advantage is going to be a little bit less than your Medicare supplement option here. You're going to have a network, but you get all these benefits typically built into this plan here. So pay a little more here, right? But have less exposures. You're going to pay a little bit less here, but you're going to have more exposures here. Now, we keep on talking about exposures, right? So we want to make sure that we cover you for all of these exposures. Now, we've talked about original Medicare, where it does not cover the majority of these exposures going to be covered by either Route 1, your Medicare supplement, or Route 2, Medicare Advantage. It's going to take majority of those exposures and address those. But there's 2 additional exposures that need to be addressed. Even if you have a Medicare supplement or a Medicare Advantage plan, these 2 exposures exist. Here's the first one. The first one is cancer, heart, and stroke coverage. I don't care if you have a Medicare Advantage plan or if you have a Medicare supplement plan, you must have cancer, heart, and stroke coverage. The reason being is because if you have a diagnosis of one of these conditions here, you're going to experience significant out-of-pocket cost. And we want to make sure that you actually get covered. Now, it is a very common misconception that Medicare absolutely covers everything, and that is simply not true. The second one, and this is a very big one here, skilled nursing coverage. Let's talk about what Medicare actually covers here. Medicare is going to cover you from day 1 to day 20, assuming that you check 2 boxes. And those 2 boxes are, you must have a 3-day hospital stay and you must be improving throughout that time period. Now, if you can check both of those boxes, Medicare is going to cover you for the first 20 days. But after 20 days, day 21 to day 100, you're going to have a copay of $209.50 each day. Unless you have a Medicare supplement, this is going to be waived. So let me repeat that again. If you have a Medicare supplement, this copay will be waived. Now, if you have a Medicare Advantage plan, you will not have any coverage for this exposure if you have a Medicare Advantage plan after day 20. Now, once you reach day 100, no matter if you went Route 1 or Route 2 with a Medicare supplement or a Medicare Advantage plan, You're responsible for all of the costs. Let that sink in for a second, right? All of the costs. So if you have an extended stay here, this is going to rack up some significant bills. And there's only two ways to address this. You could either self-pay, which is extremely costly, or you can go ahead and put a plan in place. So we need to make sure that we get you covered here. Now, what we did here at Cedar Grove is design blanket coverage options for you. So that way we can cover the majority of all of these exposures for you to make sure that you're covered and well protected. So you have different coverage options here that fit every single budget that you may have. Now, if you're at the point now where you're saying, hey, look, I'm really feeling that Medicare supplement is the route for me, right? Let's take a deep dive here into a Medicare supplement. But before we go ahead and do that, let's take a step back. Let's talk about the major exposures of original Medicare. I know you're probably tired about hearing about this, but it's very important to understand this concept. Part A, $1,700 hospital stay deductible. Part B, the important one, 20% of the entire bill with no limit, right? So remember those two things. Those are the major exposures. Then the Medicare supplement gets added on to your original Medicare, Parts A and Part B, to cover the majority of the exposures here. Then you're going to add on a Medicare prescription drug plan to cover you for your prescription drugs. Okay, so what we have here is a list of the Medicare supplement plans available. Now, I'm going to make this very, very simple for you. We're only going to focus on two, a Plan G and a Plan N. And the reason for this is because both of these plans, they're the most comprehensive, robust coverage that you can buy with a Medicare supplement, and they're the most popular plans in today's market. Let's start with the Plan G. A Plan G is going to cover you 100% of all of these charges until you get to your Part B deductible here. Remember, if we go back and we remember your Part D deductible was $257. Very, very small deductible. So if you went with a Plan G, all of these Medicare approved billed services here are going to be covered at 100% after you meet your deductible. It's a dynamite plan. If we look at a Plan N, it's going to resemble the Plan G line by line, other than two features here. One feature is that you may have some copays here and possible excess charges here, which we'll go ahead and address both of these features in a few slides from here. Now, I want to go ahead back to skilled nursing coverage. Now, the reason being is because, look, I love Medicare supplements. They're great coverage. It's the best coverage you can buy for either Route 1 or Route 2. But it still, remember, has a hole. So even if you have a Medicare supplement, after 100 days, you're responsible for 100% of the costs. We need to make sure, even if you have a supplement, we cover this here, this exposure. Now, I get asked the question all the time, Michael, how much does a Plan G cost, right? I tell you, if you tell me 3 details, I'm able to tell you your price. Your age, your zip code, and also your gender. Once we know those 3 things, we can tell you your price. But basically, it ranges from about $100 to $200 given these variables here. Also, the other question is, well, is a Plan G best or is a Plan N best? So let's stack them side by side and kind of decide which plan actually is the best. So a Plan G, remember, is $100 is your premium to $200 per month. Then we have your Plan N, which it could be $20 to about $30 cheaper per month than your Plan G. Now remember, you have a Part D deductible, $257 here, as well as your Plan N. Now where the Plan N differs is you introduce copays, doctor visit of about $20, and also a copay to an ER visit for about $50 there. Now remember we talked about Part B excess charges, right? So this is if your doctor chooses to bill above the Medicare billing rate, they can charge you 15% extra, but it's only 15% of 20%. So it's a fraction. And typically, this rarely ever happens that we see that this Part B excess charge is actually charged. But it is something to consider here. Now, at the end of the day, a Plan G and a Plan N are solid plans. We offer and we recommend these plans every single day to our clients. Which one is best is subjective to you. We need to make sure that your decision is made correctly and we fit that within your budget. Now let's talk about some key points about Medicare supplements, right? So let's talk about best time to enroll. If you're 6 months out from your birthday, it is go time on a Medicare supplement. That is the best time to go ahead and enroll, and you don't want to delay any further because you get the lowest cost rates, you avoid all the mistakes, and you basically check this thing off your list, right? Now let's talk about how these are standardized plans. So Medicare supplements, the federal government comes out and they regulate what these insurance companies must offer for coverage if they're offering a Medicare supplement. So for instance, a Plan G with Blue Cross and a Plan G with Aetna is going to act exactly the same. There is no difference whatsoever. And a Plan N with Aetna is going to act exactly the same. The only difference with these is the actual price. So let's talk about it in these terms. If I went down the street and bought a candy bar from store 1, it may be $3. If I went down the street and bought it from the different grocery store, it may be $3.50. Well, I open it up, I take a bite, well, heck, it smells, it tastes like the same Kit Kat from the other store. Well, at the end of the day, it's the same thing like a Plan G. You can buy a Plan G from this insurance company or that insurance company. It's going to smell and taste the same. The only difference that it's going to happen is the price is going to be different from company to company. So our job as a Medicare broker is to make sure that we find you the best coverage for the best price here. And we're able to do this because we have a list of more than 25 supplemental companies that we're licensed with. This allows us to find the best coverage at the best price for you and be impartial and just shop you out and see which one is the best fit for you. Now, there are some common myths when it comes to Medicare, right? Medicare brokers specifically. Let's start on myth 1. I must have to pay a fee to use a broker and to get their help with all of this, right? Simply, this isn't true. We don't charge you any fees. We're directly compensated by the insurance company and you do not pay us anything whatsoever. Now, naturally, this leads into myth 2. Nobody works for free, so the insurance company must charge a higher price if I go through a broker like you. This also isn't true. It's a very common misconception. If you go directly to the insurance company, you're going to pay the same exact price as if you went to an insurance broker like us. The benefit in using us is that we know the market, we have all the plans, and we're going to find you the best price. Myth 3. If you get paid by the insurance companies, you must have a bias towards one company or the next. Also not true. We're licensed with more than 25 supplemental insurance companies. You tell me the plan that you want, we'll set you up on that plan. We don't care what the insurance company is. We need to make sure that we find the fit that works for you. All right, so let's go ahead and recap on the 3 truths here. Truth 1, no fees. Truth 2, the price you pay to the insurance company is going to be the exact same as without using a broker. Truth 3, with over 25 companies we have to choose from, we are not biased. You tell me the company you want, we'll set you up in that plan. Now, remember, with Route 1, to cover the major exposures of Medicare, the majority of them, you did a Medicare supplement, which is the route that we're talking about right now. With that route, you have to buy a standalone prescription drug coverage plan. So we're going to dig in a little bit deeper to prescription drug coverage here. Now, let's take a step back first, right? So you have your original Medicare, you couple that with a Medicare supplement here, and then you add in your prescription drug coverage to complete it off. So prescription drug coverage for 2025 has changed very drastically recently. There's one major thing. There's a prescription drug cap on what you will pay for prescription drugs in the amount of $2,000. So anything beyond that, you're not going to have any charges. Now, in addition to that, we also want to bring this to your attention. There's a late Part D enrollment penalty. So for every single month that you do not enroll in a Part D prescription drug plan, when you first become eligible, you're going to receive a lifetime penalty of 1% every single month. We want to make sure that you don't get caught in this trap here. So let's talk about our deeply involved Part D process, how we choose your actual prescription drug plan, what leads us to the solution, right? We're going to go ahead and look at all your medications. We're going to collect all of those, right? We're going to collect your pharmacy. We're going to get your zip code. And after we have all of that information, we're going to plug it into our software. It's going to deliver all the options to you. At the very end, we're looking at when you fill all your prescriptions for that given year, how much is it going to cost you? And then we then recommend that plan that is the most cost effective for you. So we're actually tailoring it for your specific drugs in your pharmacy as well as your zip code. Then once we find that plan, we go ahead and enroll you into the plan of your choice. Now this is a big one because this one's not focused on nearly enough with most Medicare brokers, and this is where we shine. So every single year, we're going to reevaluate your plan. Now, what does it mean by annual election period, right? Every year you have the option to change your Medicare prescription drug plan. And the reason being is because every single year these plans renew. So the plan that was once good for you in 2025 is drastically different in 2026 when that plan renews. So what we need to do is get with you on the phone every year, discuss this process with you, and for us to analyze and take a lot of the weight off your shoulders. So you don't have to go ahead and reevaluate your plan every single year. Rely on us for that. So recapping here, you're going to have original Medicare for Route 1 with a Medicare supplement coupled with a prescription drug plan. Now remember, we're going to complete this whole package with blanket coverage because your Medicare supplement is covering the majority of your exposures here, but we're going to cover the additional 2 exposures, cancer, heart, and stroke, as well as your skilled nursing care coverage by blanket coverage here. Now, if you're deciding Route 2, now we have a tremendous amount of clients, thousands upon thousands of clients on Medicare Advantage plans, as well as Medicare supplement plans. People feel very strongly about one option or the other, but at the end of the day, it depends on your individual situation. So we're going to dig a little bit deeper here into Medicare Advantage. A Medicare Advantage plan is a managed care plan. What does that mean? This is an individual insurance company providing your insurance care here. It must include Parts A and Part B, and also these plans include Part D prescription coverage built into them. Now remember, unlike Medicare supplements where you have to buy a standalone prescription drug plan to pick up your prescription drug coverage, with Route 2, a Medicare Advantage, that drug coverage comes built in, so it's a little bit easier, but it's somewhat of a downside because it's a prepackaged plan. You can't design that prescription drug plan as much as what you can with a standalone prescription drug plan here. Now the cost. The cost with Medicare supplement plans, it could be as low as $0 a month. And you must still pay your $185 Part B premium, regardless, remember, if you go Medicare supplement or Medicare Advantage here. And then lastly, your coverage on a Medicare Advantage plan is going to resemble like an employer plan in the form of copays, deductibles, coinsurance, and out-of-pocket maximums. Now, at the end of the day, we necessarily do not care what route that you choose. If you choose Medicare Supplement or Medicare Advantage, we're not biased to one route or the other. But if you do choose to go with a Medicare Advantage route, we must make sure that we cover those additional exposures by implementing blanket coverage here, because you're going to have some exposures if you do take the Route 2 of Medicare Advantage. Now, we've talked about our process, our Part D process of how we choose your prescription drug plan. Well, it's similar to the Medicare Advantage plan process that we have for you. We collect your zip code, your doctors, your hospitals, and your medications. Once we have all that information, we plug it into our software. Once again, it gives us the available options that are offered to you, and we customize it to the plan that actually covers all of these details here. In addition to that, we may ultimately choose a certain plan for you that if you're very interested in gym, dental, or over-the-counter benefits, we can make sure that we get you covered there as well. Now let's talk about when to sign up with a Medicare Advantage plan. So there's an initial enrollment period. So this is when you turn 65. Your window to enroll into a Medicare Advantage is 3 months before your birthday month when you turn 65. Unlike a Medicare supplement, you have 6 months prior to your window. But what we want to impose on you is that it's very critical to go ahead and enroll and start the process here 6 months prior to your birthday month, because we want to get that ball rolling for you to make sure that you miss any kind of possible mistakes or penalties on this side. In addition to that, let's talk about the annual election period. So this is your opportunity to change plans if you have a Medicare Advantage plan. Similar to the prescription drug coverage plan, those plans renew every single year. So at the beginning of every single year, the benefits change. The same thing with the Medicare Advantage plan. So in this window, October 15th to December 7th, we have the opportunity to go ahead and switch your plan. Now the reason for that is because your doctors may not be covered. Your Medicare medications may not be covered here. So we want to make sure that we choose the best plan for you. And in-house, we're doing this every single year, which is a huge benefit of working with us. Now let's go ahead and put these two options side by side, Route 1 and Route 2, Medicare Supplement and Medicare Advantage, right? Now remember, these two routes cover the majority of the exposures of Medicare. Let's start on Route 1. Route 1, you're going to have a price of $185 for your Part B premium. You're still going to pay that on the Medicare Advantage side, right? Now remember we talked about the premium for a Medicare Supplement. It's going to roughly be about $100 to $200 per month. Let's just say $150 given your situation, right? So $150 here. Medicare Advantage plan, most of the time, they're going to be $0 premiums. So it could be extremely low. The coverage with a Medicare Supplement, it's going to give you the best coverage that Medicare can buy with absolutely no network. You can see any doctor you want, as long as, remember, that doctor accepts original Medicare. Now, if we walk over to the Medicare Advantage side, the difference here is that the coverage, you're going to have higher out-of-pocket expenses. Remember, it's going to act like an employer plan. In addition to that, just like your employer plan, you're going to have a network. You're going to have to see certain doctors that accept that individual plan. Medicare Supplement, your Part D coverage, you got to go out and purchase that individually, a la carte. Over here on a Medicare Advantage plan, typically this comes included as well as the extra benefits, which is a really nice feature here. Now I want to go ahead and harp on this again because this is extremely important, because on the previous slide you can see here, these are the two routes to cover the major exposures of Medicare. But remember, there's still two additional exposures that must be covered with either route that you do. And we do this by blanket coverage like we previously described. So I just want to go ahead and mention this as well. This is very important. And what I want you to do is you decide before we have our one-on-one conversation with you, which blanket coverage may work best for you. All right, so as we transition into our Medicare decision, that decision is simply not a health insurance decision. It is also a retirement decision, which I would argue, which is even a larger decision, or just as large as what your Medicare decision is. So questions that may arise. Do I have enough money to retire? When should I retire? Should I start Social Security? Should I delay Social Security? These are some large financial questions that need to be answered, and they're not simple questions. Please, if you need help, reach out to us. Let us know when you book your one-on-one Medicare session with us to ask us any kind of questions that you may have here about retirement. We have a detailed specialist in-house who helps with retirement planning. Some of the accounts that we work with here. So we offer assistance with employer plans such as 401ks and 403bs. In addition to that, market-driven accounts, which are brokerage accounts, mutual funds, and individual stocks, and also liquid accounts as well. All right, so let's go ahead and wrap everything up here, right? So let's recap. Let's talk about the phases, the steps. Check off this box. You already completed this one here. You completed your education by doing this one-on-one seminar here. Congratulations, you stuck with me for 30 minutes. Phase 2, so this is an extremely important one here. This is definitely where you need to book your one-on-one consultation with us now by clicking the blue calendar link below, because this is going to allow our representative to detail the conversation around your needs of what's specific for you. During this phone call, you're going to go ahead and receive a personalized Medicare roadmap. And what this is going to do, this is going to give you a checklist of a step-by-step process as you go through your Medicare decision here to make sure that you don't miss anything. In addition to that, it's going to come with a formal recommendation, what you should do, in addition to a cost summary here. Now lastly, phase 3. This is a very, very important one. This is something that I pride my office on. A lot of the times you find individuals, Medicare brokers, they set up a plan and they ghost their client after that. They never hear from them again. We pride ourselves in staying in touch with our clients. We offer lifetime billing and claim support for every single client that we have. You should never ever call the insurance company directly and ask them a question. Rely on us for that. Our dedicated staff is here to answer any questions that you may have. And last but not least, free annual reviews. I can't talk about this enough. And the reason being is because remember, your Medicare Advantage prescription drug plan, those plans change every single year. The plan that you had last year is not going to be the same plan as the following year. So we need to make sure that that plan we review every single year to make sure it's the best one for you. In addition to that, Medicare supplements, remember the price changes. We're going to make sure that we get the lowest price for you each year on Medicare supplements. So we've had a lot of issues with individuals finding the blue calendar link where to schedule the appointment. So when you see this, this is what you want to click on to book your one-on-one session with us. All right, so last thing, look, I understand your time is valuable. You spent over 30 minutes with me here today. I greatly appreciate your time. Your Medicare decision is a very complex decision and it needs to be done right from the start. Hopefully this live webinar video has helped you come to that decision, and we look forward to you booking that one-on-one session with us so we can answer all of your detailed questions and help you safely transition to Medicare. Thank you, God bless, and we'll talk to you soon.